I'm Randy McDonald, Senior Vice President of Human Resources for IBM. Healthcare is a subject that's constantly on the minds of all of us. It's no wonder. The environment is changing with the emphasis on cost and quality of care. There are a number of issues surrounding healthcare in this country. This video is designed to tell you about what we know and what we've learned. Things that can help you maintain your health and manage your healthcare cost. Issues and tips on Medicare, generic drugs, questions to ask yourself when deciding what type of coverage is best for you and your situation, and things that you can do to keep yourself healthy. Health is more than a national debate. It's very personal. So I encourage you to watch the following and add it to your knowledge bank on what makes you an informed healthcare consumer.
Expect to reach deeper into your pocket if you need health care.
Around the country, seniors face rising prescription costs.
Medical inflation is back.
Seems that every time you turn on the television or radio or look in the newspaper, someone's talking about the high cost of health care and prescription drugs. Hello, I'm Wilford Brimley, and today I'm speaking as someone who shares your concerns about the rising cost of health care. And as a longtime diabetic, it's something I have to be concerned with. Sometimes it can be pretty scary. Projections show that by the year 2030, more than 70 million people in the United States will be 65 or over. Now that's twice as many as we have today. With numbers like that, healthcare education and emphasis on prevention are going to be critical to improving the health of our aging population. And that's why as retirees, it makes it even more important that we're informed consumers, so we can do what's best for our families and for us. It's amazing, but many retirees go without health care coverage. Most retirees under the age of 65 have to purchase health care coverage on their own or have none at all. And that's because less than 35% of all U.S. companies still offer health care coverage to retirees under the age 65. Fewer yet, less than 30% have supplemental coverage for those retirees eligible for Medicare. Those of us who have coverage still need to take an active role in exploring choices and making decisions about our health and our health care. So as people concerned with our health care, there are some things that we should talk about, like the type of things you'll need when you're deciding on your coverage, ways you can reduce your expenses, and other ways you can help control health care costs. Now you can start thinking about the first one right now. Are you eligible for Medicare? What do you need to cover? What are the benefits that you and your family need most? What kind of monthly contribution can you afford? What level of deductibles and co-payments are you comfortable paying? Now, these are just a few of the questions that you'll want to answer before making a decision on the type of health care coverage you need. Which plans cover your current doctors, pharmacy, and hospitals, and does this matter to you? What are the limitations of each plan, and what are the alternatives to each plan? And what are the pros and cons when compared with your specific needs? Let me give you some real-life examples to get you started. If you're over 65 and retired, remember that Medicare is always considered your primary medical coverage. Other plans, such as those from a former employer, are there to cover many of the things Medicare doesn't. Things like helping with prescription drug coverage or preventative physical exams. Do you have other coverage through a new employer or a spouse, and could this coverage fill in any gaps? Ask yourself how much financial protection you want. Are you most concerned about having coverage for prescription drugs, which Medicare does not currently provide? Maybe what you'll need is coverage that just takes care of your drugs, filling Medicare's gap. Regardless of whether or not you're eligible for Medicare, there are other considerations for you. Maybe you need protection from catastrophic costs, those big ticket medical costs. If you stay in the hospital for a week or two, you can quickly run up a tab in the tens of thousands of dollars. Plans that cover these big ticket items cost you more for what I call regular maintenance, but if something big comes along, you're protected from a financially devastating situation. Managed care, like an HMO or a point of service plan, can be a good option for many retirees and their families. Managed care is a kind of health plan that relies on networks of doctors and hospitals. These healthcare providers agree to certain preset prices for their services, which keeps costs down. This keeps your costs low and predictable. There are also incentives, like lower co-payments for retirees who use these in-network doctors and hospitals. Managed care began back in the 70s when governments and businesses were paying bigger and bigger health care bills. A trend that had no end in sight. At that time, health care costs were already equal to 12% of the gross national product and were predicted to be at 30% by the turn of the century. That's monumental. Once again, just after the century mark, healthcare costs are rising faster than inflation. Many Americans are paying less out of their own pockets by signing up for a managed care plan. This includes more and more retirees. With those retirees who still have employer coverage, the majority, 68% of those under age 65, is now covered by some type of managed care plan. Should be part of the equation when deciding what works best for you. No matter what type of plan you choose, you'll have to weigh the coverage and the cost. It's like automobile insurance. A higher deductible means lower premiums, and a lower deductible means higher premiums. Now, if you'd rather budget for a monthly premium and avoid the potential for higher out-of-pocket expenses at unexpected times, the lower deductible plans may be right for you. If you'd rather save money each month on the premiums and budget for out-of-pocket expenses, then the higher deductible plans or a catastrophic type of a plan may be your choice. You need to weigh all your options as you're choosing. But after you've decided what type of coverage is best for you, there's still things you can do to keep your costs down and get the kind of care you need. Especially for our generation, sometimes we aren't comfortable asking our doctors questions. But it's important to ask them. You and your doctor are a team working to improve your health. So you want to be certain that you fully understand what the doctor wants you to do. If you need to be hospitalized for a procedure and you have the choice of hospitals, experts recommend that you choose one that does that particular procedure quite often. They're called centers of excellence. It's vital to understand your health care issues. Ask for brochures or literature about any procedures or diagnoses. As soon as you're eligible for Medicare, sign up. You've earned it, you paid for it through Social Security. It's your primary coverage after age 65. To be sure you maintain comprehensive coverage, you must enroll in Medicare Parts A and B as soon as you become eligible. If you don't enroll, it's probable that your other health care coverage assumes that you have enrolled and pays accordingly. So enrolling is really important. And you need to make sure you know how Medicare works. It covers a lot, but not everything. Like the prescription drugs. It's up to you to make sure whatever supplemental coverage you choose does a good job of complementing Medicare coverage in a way that meets your personal and medical and financial needs. For example, if your bill is $1,000 and Medicare pays 80% or $800, then you look at what your other plan would have paid for that procedure. If it would have paid $800 or less, you wouldn't get any additional coverage. But if it would have paid $900, then you'd get the additional $100 from that plan to help pay for the procedure. Now you want to make sure that you know what's covered and what is not, and how. By finding out beforehand, you'll be less likely to be surprised by a bill. Make sure your doctor has your complete medical history. Sometimes it's hard to remember all the details, so you may want to make a list. This comes in handy when you visit specialists or new doctors. Include surgeries and procedures you've had in the past, those dates, things you're allergic to, the medicines and supplements you're taking, your family's history of diseases, and the dates of your last checkup and those routine maintenance things. It's also a good idea to have this same information about your spouse in case you need it in an emergency. Again, we were raised believing that doctors know everything, but we need to tell them when something isn't working for us. Don't be afraid to voice your opinion or ask questions. They see many patients every day. Don't hesitate to remind them of your medical history or the drugs you are currently taking. Doctors know a lot, but you also know about what's going on with you. There's no doubt about the value of an emergency room when you need it. Unfortunately, many people use the ER for non-emergencies. It's expensive, bogs down a system that should be focused on urgent care. So use the emergency room for just that, emergencies. Whenever possible, ask for a generic prescription drug. In most cases, generic drugs are the same as a brand name drug, but cheaper. Depending on your coverage, this can make a big difference in out-of-pocket expenses. If your plan has mail-order prescriptions, take advantage of this. Mail-order prescriptions can provide a significantly lower cost for you, and they're convenient too. Your prescriptions are delivered right to your door in a confidential envelope. Some of us don't always take such good care of ourselves, but as we age, we should all start having greater respect for the phrase, an ounce of prevention. The best way to save money on health care is to stay healthy. Don't forget the regular preventative visits, just like that regular maintenance you schedule for your car, and it may include going in for a flu shot or having regular physicals, mammograms, prostate tests, and so on. Try and eat right, especially if you have medical dietary restrictions like I do. Exercise to the best of your ability and reduce stress. Who needs it anyway? Well, that's about all I have to say. I know it's a lot of words, a lot to think about. But these days we have to take an active part in managing our health and our health care. Whichever path you choose to take, good luck to you. And here's to many healthy, happy years. And thank you.